My name is Huang. I'm an occupational therapist and certified hand therapist, and I'm the owner of Hands-On Therapy Services. We brought Radial Shockwave to the clinic, and I have so much more information if you're interested in learning more about how this type of treatment can help you with any type of tendon or muscle types of pain. It's non-invasive. It helps you to get rid of pain like really fast, the fastest I've seen. Even if you've tried therapy, injections, and you're really looking to avoid surgery and you're looking to avoid injections, this is a really great alternative to any of those things, taking pills and, having the pain kind of go away, but not go away. And then maybe you go to the doctor and they offer you injections or side effects to that. And if those things don't work, and then you have to wait until it's really bad in order for you to even qualify for surgery, right? If you're looking to avoid all of that, ask me more about Radial Shockwave. But when I tell people about Radial Shockwave, they're like, oh, well, is it like ultrasound? And here's the thing, right? I've been in therapy for over 20 years, and ultrasound is actually one of my least favorite therapy tools to use with my patients. Do we have that machine in our clinic? Absolutely. Do we use it? It's not my favorite. I don't use it. If I'm going to spend any amount of time with my patients, ultrasound is not the tool that I pick to use it. And here's why. I don't find it to be effective when I'm doing a treatment, right? I just don't find it to be effective when I'm doing it. There is no feedback that, oh yeah, it works. And it's because when you put on ultrasound, one, they're not supposed to feel it. Right? You're not supposed to feel it. I've done ultrasound to myself. You're not supposed to feel it. If you feel it, then it is too aggressive, right? Ultrasound is essentially taking sound waves and turning it into heat. So the whole point of using ultrasound is to provide deep heat down into the tissues, deeper than like a hot pack would provide, right? The best way that ultrasound has shown to be effective is if you put the tissue in a stretched position, or it can be, I think there's a lot more research that says yes, for scarring it can help, but you have to constantly put that tissue on stretch and then ultrasound it, and it takes a lot of sessions before you even see the result or feel the results of it. It's usually used in conjunction with therapy in order to get best results. The difference between radial shockwave and ultrasound: radial shockwave provides a different level of waves. It provides pressure waves, right? Instead of sound waves that turn into heat. There is no thermal effect, no heat with this. What this does is use pressure waves, and it penetrates deep. And what it does is it breaks up and it helps the tissue heal at the cellular level, all the little tissues underneath the skin, deeper than what you can see and feel. But with this machine, when you have a treatment, one of the things that we do here at our clinic is we're looking at what hurts you, what movements hurt you, so that we could effectively apply this and apply the right dosage, which I find has been the most effective. Now, you're supposed to feel this a certain way. You're supposed to feel the radial shock waves. It feels like a snapping type of sensation. Sometimes people describe it as a little electric pinpoint type of thing. Sometimes when you find that spot that is hurting and you put the machine over it, the applicator head over it, you almost feel like this deep ache inside. You're like right there. This is how I feel. I put it on different patients of ours that have had surgeries, who have had just tendinitis pain. My staff have used it. When you call us here at Hands-On Therapy Services, ask them how they feel about it. We've been able to apply it, and immediately you feel the results. We're looking for pain relief with radial Shockwave, and it's really good and very effective with getting rid of your pain, reducing your pain, getting rid of your pain. Obviously, depending on where it's located, the severity of your pain, how chronic it is in nature, those things really can affect how many sessions you need. But when we've been applying it and using it, I've seen fast results, faster than I've seen anything else. And I think if you're interested and you have tendinitis types of pain, you could have shoulder problems, elbow problems, hand, wrist problems. You could have lower back issues, upper back issues. You can have knee pain. This has been so effective in reducing that pain so you can become more active, lift heavier weights, just walk and sleep like normal without having to feel it all the time. This can also help you do your therapy more effectively, because when you get rid of your pain or start to reduce and get yourself out of that pain cycle, you'll be able to participate in your therapy, the exercises more effectively. So again, my name is Huang with Hands-On Therapy Services. If you want to learn more about what Radial Shockwave can help you with, getting rid of your pain and getting rid of it fast, give us a call here. Give us a call here at Hands-On Therapy Services and let us know what's going on so we can help you. All right. And of course, the guide that I have written everything about Radial Shockwave, a lot of the questions that people have been asking me, that is all written down in our free guide. Please grab it. Let us know how we can help you. All right. Talk to you soon.